Trulicity and gastrointestinal issues, 15 solutions. Trulicity, dulaglutide, is a GLP-1 receptor agonist used to treat type 2 diabetes. While it can be highly effective in managing blood sugar levels, like any medication, it may cause certain adverse effects. Common adverse effects of Trulicity can include gastrointestinal issues, such as nausea, vomiting, diarrhea, and decreased appetite. Here are different ways to manage these adverse effects, including both pharmacological and non-pharmacological approaches. Non-pharmacological approaches. Start with a lower dose. Begin with a lower dose of Trulicity and gradually increase it over time. This can help your body adjust to the medication more easily. Pair with meals. Take Trulicity with your meals to reduce the risk of nausea and vomiting. Food can help slow down the absorption of the medication and ease stomach irritation. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration, which can worsen gastrointestinal symptoms. Eat smaller, frequent meals. Opt for smaller, more manageable meals to ease the burden on your digestive system. Choose easily digestible foods. Favor low-fat, easily digestible foods to minimize the strain on your stomach. Proactively manage nausea. Use ginger-based remedies, acupressure wristbands, or other methods to alleviate nausea. Exercise. Engage in regular physical activity, as it can help improve digestion and reduce gastrointestinal symptoms. Manage stress. Stress can worsen gastrointestinal issues. Practice relaxation techniques like meditation, deep breathing, or yoga. Pharmacological approaches. Anti-nausea medications. If nausea is severe, your healthcare provider may prescribe anti-nausea medications to alleviate symptoms. Anti-diarrheal medications. For diarrhea, over-the-counter anti-diarrheal medications may be helpful under the guidance of your healthcare provider. Adjust dosage. Your healthcare provider may adjust the Trulicity dosage or dosing schedule to mitigate gastrointestinal side effects. Consider alternative medications. If adverse effects persist, your healthcare provider might explore other diabetes medications that better suit you. Prokinetic agents. If gastroparesis, delayed gastric emptying, is an issue, prokinetic medications can help improve stomach motility. Switching GLP-1 agonists. In some cases, switching to a different GLP-1 receptor agonist may lead to fewer adverse effects. Open communication. Always keep the lines of communication open with your healthcare provider, discussing any concerns or questions you may have about Trulicity. Remember, everyone's response to medication is unique, so it's crucial to work closely with your healthcare provider to find the best approach for managing any adverse effects of Trulicity. By combining these strategies, you'll be better equipped to navigate the Trulicity journey with confidence and ease, achieving better diabetes management and improved overall well-being.